Welcome to all my dears. Now we are going to discuss about a form of chronic thyroiditis, namely Riddle's thyroiditis. Clinically, it's a very rare condition, but at the same time, it is very important also. It is usually seen in female, especially in female with age more than 40. Here, the thyroid gland is replaced by a dense infiltrative fibrotic mass and which may extend up to the trachea or the same may surround around the neck muscles, or it can extend up to the mediastinal also. So there is a great possibility of mediastinal compression or mediastinal fibrosis, or a great possibility of retro-peritoneal fibrosis also. In such condition, the patient usually complains with compressive symptoms. That means the patient feels very difficult to swallow, even with the liquids. There is inability of the upper extremity to raise the upper extremity above the neck levels because of the compression of the nerves. The patient cannot do the same. And in such condition, the same has to be differentiated from a case of thyroid carcinoma. Usually, such diagnosis is made after the operation or after the surgery, because most of the patient consider it only as a case of goiter, and that may not cause any problem to the patient. Or even by the doctors may think that on examination the thyroid values or the hormone values seems to be normal, or our patient may be a little hypothyroid also. But the issue is the fibrosis or dense mass of infiltrative fibrotic tissue that extend into the mediastinum and thereby compress a great possibility of compression of the blood vessels or nerves, and thereby the same may leads to danger to the life of our patient. So by simply palpating the gland, you cannot take a decision. At the same time, by doing CT or MRI, you can understand the extension of the fibrosed gland. So take care. That's all about the Riddle's thyroiditis. Thank you. Thank you for watching.